Hey, my name is Mecklin Soules, and I'm here doing Trach Care on my patient, Mr. Jones. We've just done suctioning, so I've already identified him, and we're going to go ahead and perform our hand hygiene. Mr. Jones's O2 sat is 95, so we do not have to hyperoxygenate him before we do this. Mr. Jones, at any point in time this becomes uncomfortable, please raise your hand and let me know and I will stop, okay? Okay, so the next thing I'm going to do is I'm going to put my mask on, my eyewear. I'm going to pull my table up to my patient and try to prevent turning my back on my sterile field, okay? Okay, so we're going to open up our sterile supplies. So we are going to open away from us and not reach over. I'm going to grab my sterile gloves out of here and move them here to the side. I'm going to lay down my sterile towel. We're going to reach in and grab it. The shiny side is going to go down. I'm going to make sure that I'm keeping that good barrier. That shiny side. So we're going to go down with that, right like so. The goal would have been to get it to cover my full table, but since we are where we are, we're just going to try to keep it right in the center of our sterile field. The next thing we're going to do is we're going to dump our supplies right in the center, okay? And then we're going to leave our tray over here to the side, and we're going to pour our sterile water. Now, if he was infected, we would add some hydrogen peroxide to that, but he's not. We've got some sodium chloride irrigation, and it's expiration date December 2018, so we're good there, okay? First thing I'm going to do is lip this because we've used it before. And I'm going to come in and I'm going to pour and I don't want to reach over my sterile field, so I'm going to keep on to that little area that we lipped. Okay, and I can put my little lid back on. All right. Next, I'm going to put on some gloves. We're ready to take this cannula out. All right, so we're going to stabilize the flange. Take out the cannula, put it right into the sterile water, okay? All right, next I'm going to go ahead and put on my sterile gloves so that we can clean our cannula. I'm going to move this stuff off of my area. first thing I'm going to do is to clean my trach. So I'm going to take a little cleaner. Before I do that, I just want to kind of get my Q-tips and stuff over here to the side. Don't need the pot cleaners. So I'm going to throw them off. I'm not going to need that. Okay. So I'm going to hold this over the container in which I've got it. Okay. I'm going to clean the outside. And I'm going to clean the inside. Alright. At this time, I'm going to put this over into my other saline container to let it sit there for a minute and rinse. Okay? Alright. Now, I'm going to just come over. We're going to, at this time, we're not sterile anymore. We're going to take this dressing. I'm going to stabilize the flange again. All right, and we are going to use this saline that I have not put anything in. I'm going to clean up under the flange. I'm going to take my Q-tips. I'm going to go around the ostomy site. Okay. All right. This time we can take our cannula and we're ready to go back in. So we're going to take it, we're going to tap it off. The side. We're going to go back in and make sure we lock everything down. All right. Last, I'm going to put, I'm going to change out the neck stabilizer, the trach stabilizer. And I can have one of you pass me the neck stabilizer. That'd be great. It's right there. Thank you. Fell off my field. I would potentially get a new one, or get somebody to hand me this one. All right. So we don't want to take this stabilizer off till we get the new one on. So the key thing is to go ahead and make sure that we're putting it on correctly. Because that's what we don't want to do. We don't want to put it on backwards and then have to come back later and or in the middle of us trying to do it and readjust these, okay? So, Mr. Jones, you doing okay? Yes, I'm fine. So I'm just gonna stabilize the neck. Go around. Okay, so essentially we would not remove one side until the other side is on, or not remove the old one until the new one is on. And not pull this trach out. That's our main goal. We do not want to pull it out. and secure. We're going to go ahead and pull it out. All right. Make sure that this is tightened down where we can fit one finger up underneath it, okay? Throw all of this away. Last thing we're gonna do is we're gonna put this dressing back around. So we would just come over here and run this right up under the cuff to where it's right around the stoma. Whenever I removed the first one, I would check and see if there's any type of drainage, any type of foul smell, any signs and symptoms of infection, just to make sure that the trach was doing good and there was no infection. I'm going to reassess this patient. I'm going to check his O2 sat, which is 95. He's doing good. I'd listen to him and make sure he sounds good as well. Mr. Jones, you did good. I think we're good. Thank you.